Case named Neil, age is 37 years. Today date is 9th of September 2019 and complain of high pitch voice from puberty. Neil, I want speech sample. Say something why you came.
Actually, I was having this high pitch voice for a long time and I thought this is like genetic. Then I didn't approach any doctors, but I was looking online for a long time. Then I came across your videos and I didn't trust right away. I was looking over the period of time before pre-session and post-session. Looks like more of genuine cases have been. So that's
yes, in our video, if any video anyone is watching, they will find pre and post both. But nowadays people in the social media, without any effort, also trying to become something star. So they will put either before or either after. They will not put before and after. And they will give a lot of lecture. Okay, puberphonia can be treated by this exercise, that exercise. But you will not find before and after video. So those who are watching this video, I have a message also. So once you see before and after both, then you should have a faith. Otherwise, you may be cheated.
That gave me the confidence actually. So that's why I'm here.
Okay, tell your hobbies.
I like reading books, watching movies, especially thriller and horror movies.
Okay. From which place you came?
I'm from Hyderabad.
So thank you so much for coming from so far distance. We'll do the needful. Thank you so much. Posted a video of Mr. Neil, and today date is 16th of September 2019. So Neil, I want speech sample after the treatment. How do you feel after treatment?
I feel more comfortable right now with my new voice. I can talk something. I'm Neil, I'm 37 years old and I'm from Hyderabad. And this is a wonderful session for me for the past 8 days. I really enjoyed it, in fact. Of course, little bit doing some vocal exercise was little troublesome, but it is enjoyable.
Anyway, we asked the patient to practice at comfort level. So maybe it was a continuous session, so maybe little monotonous.
But I can see the change right now.
So have you spoken to any friends or family members?
I spoke to a few of my friends. Some of my friends thought, what happened to your voice? They were surprised a little bit. I haven't called my home, but I was talking to my mom regularly, so I cannot call her and ask, is there any difference? On the second day itself, she told me that, what happened to your voice?
Now when you are calling to friends, what they are saying?
They find it someone else actually.
Means they are not able to recognize you?
Yes.
Okay, so can we use your video for awareness purpose at YouTube channel and the Facebook?
Yes, please.
Okay, and thanks for the permission. And what do you want to say to the people having similar problem?
If you think you have high-pitched voice, I would recommend come to Sanjay sir before going anywhere else.
Thank you so much for recommending. And those who are watching this video, I will suggest to you, in Google search, write SLP Sanjay Kumar video, and you will find so many videos before and after treatment, and that will give you a lot of confidence if you have any kind of communication problem. So nowadays what I am seeing that people of their unemployment, and because of that they want to become public figure with the help of social media. So they are putting some therapy technique of Puberphonia, speech problem. And in fact they are not speech pathologists. So, and I am seeing some patients who are practicing based on those suggestions, they are developing vocal nodule and vocal polyp. So when we want to become a speech pathologist, 4-year bachelor and 2-year master, 6-year studies is required. And so just watching few minutes video and following those technique may or may not harm. So be careful. Those who are watching, I am suggesting to them. And try to meet speech pathologists. And if you have a voice problem, and if you are seeing someone's video just before puberphonia treatment, after puberphonia treatment, don't blindly believe. Right. After treatment also it can be fake. Right. A normal person is saying, I had puberphonia, I was cured by this XYZ doctor. So try to find his before video, before believing on him. And if you are just seeing before treatment video, so some patient has reached to their doctor.
Yes.
But how after the treatment was? Just try to find out.
I would suggest to people always go through the videos before post-therapy, pre-therapy and post-therapy. Not one video, couple of videos so that you can really.
And nowadays what the people are doing, because they know something or maybe something they will try. So some changes they can transfer, like saying 1, 2, 3, amma, appa. But communication is not 1, 2, 3 and appa, amma, appa. It should be general conversation. So how the voice was before treatment, during the conversation, like talking like this, and how the voice is after treatment, during conversation, don't get impressed by listening 1, 2, 3, 4. Okay?
I would suggest just watch couple of videos, then you will clearly understand where to go.
Okay, thank you so much.
Thank you.
Thank you so much for coming from so far and showing faith in us.